Is topical finasteride better than oral? I covered this a long time ago, and some studies claim that topical finasteride decrease serum DHT by less, therefore there's less chance of side effects. That's assuming serum DHT suppression is a reason for side effects, which hasn't been proven. However, they were comparing a low topical dose versus a normal oral dose. In other words, they compared 50 to 400 microliters of topical finasteride that was applied using this device here to a full 1 milligram oral dose. So yeah, if you use less of the medication, it's likely going to lead to less suppression of serum DHT. But the reality is that most men will use anywhere from 1 to 2 milliliters to cover their entire scalp, especially if they have anything longer than a buzz cut. And as you can tell, 1 to 2 milliliters pretty much has the same serum and scalp DHT suppression as a 1 milligram oral dose. In other words, they're not much different at all, hence why the FDA has been cracking down on companies advertising topical finasteride as less chance of side effects, which couldn't be further from the truth. The only benefit that topical has over oral is that the plasma concentration of finasteride does seem to be significantly lower for topical when comparing equally effective doses. But this hasn't translated to less chance of sides in the literature so far. Also less likely for someone to nocebo themselves just due to the stigma around oral finasteride versus topical. But the negatives include increased chance of scalp irritation on top of possibly exposing a pregnant woman with a male fetus to the medication, leading to birth defects.